Hi guys, Dr. Brotsky here. It's week 18 of your pregnancy. If you haven't looked at the previous videos for week-by-week pregnancy information, check those out. Right now, at 18 weeks, your baby's about the size of a sweet potato. So baby is growing a lot. There's a lot of exciting movement happening as well. Things to expect right now from your end are to have more regular fetal movement. You may possibly not feel fetal movement, especially if you have a placenta that what we call is anterior, meaning in front of your uterus. Those patients tend to feel fetal movement a little bit later. You can also feel fetal, saying that F word.
You can also feel.
Okay. You can also feel the baby's hiccups around this time, which might feel like little muscle spasms in your lower abdomen. It's hard to mistake baby's hiccups, so you might notice that as well, which is totally normal. You might start to feel that your legs get swollen when you stand up too long. If that happens, just make sure you're drinking plenty of water, sit down and elevate your feet. You want to elevate them about the level of your heart if you can. You might start to feel that your legs get swollen sometimes. This is totally normal. You have a lot more fluid in your system right now. So when you stand up too long or you're on your feet for a long time, no, it's the same thing. Okay, I'm going to do that again. You may also start to notice that your legs get swollen if you're standing up for too long. This is very, very common in pregnancy because of all the extra fluid in your system. So if you notice that's happening, make sure you're drinking plenty of water, sit down and elevate your feet as much as you can. And it'll usually go away. If it doesn't go away, make sure you tell your doctor about it. Things from a doctor's perspective at around this point in pregnancy, around 18 weeks, are we can start talking about and doing the anatomy ultrasound. I mentioned that at the last visit. So around 18 to 20 weeks, we typically will be able to do a full survey of the baby's anatomy and make sure everything is developed properly. A lot of people ask me who they should bring to that ultrasound, which is a common question. And there's no right or wrong answer, but if you think of this like an examination of your baby, that's kind of a private thing. So I wouldn't invite everybody just in case there's something that comes up, but you may want to. That may not matter to you at all or make a difference. So just keep that in mind, that it is a medical exam of your baby and whoever you'd want present for that to bring along with you to the appointment. But don't overcrowd the ultrasound room because usually more than a couple people can add up pretty quickly. The other thing to make sure you're checking on is that you're on track for your weight gain, so check in with your doctor about that. In general, things to do around this time are to start checking into your maternity leave coverage at work so that you can maybe start doing some preliminary planning about how to enjoy that time and use that time efficiently at home with your baby. You also can start drinking more water and elevating your feet, as I mentioned before. So that's it for week 18. Thank you so much for watching this video. Look at my other videos to check out every week of your pregnancy, and you can always find me at drbrotsky.com.